Hi, my name is Dr. Elizabeth Alvarez, and I'm presenting on behalf of my colleagues and the COVID-19 Policies and Epidemiology Working Group on limitations of policymaking using COVID data, specifically barriers to testing and reporting. Since COVID started, we have noticed many data and surveillance gaps. The reason this is important is that pandemic-related policies such as social distancing or work from home can help decrease infections, but may also be socially and economically disruptive. However, policymakers and the public look to these epidemiological numbers to decide when to institute policies and to see if they've worked. We've developed a multiple case study using countries or provinces and states, using documentary reviews, such as government sites, media articles, and peer-reviewed journals. We've also used key informant interviews to verify information that we have found or to fill in gaps. We have developed case study reports and are completing comparative analyses. One thing that has worked really well are our weekly group meetings where we discuss what is happening in each of our jurisdictions. These are some of the countries we're including. As you can see, we're relying on these numbers to be accurate in order to make decisions about what policies do work. But we've identified many barriers to testing and reporting. The first level is at the healthcare recipient level. People have to go get tested. In order to do that, people need to know that what is COVID, that it can be severe, and when to get tested, or that there are even tests available. Testing criteria have changed throughout the pandemic. In some places required referrals for testing, which adds burden to people. Once people decide to get tested, there's a lot of decision-making that is involved in that. For example, their health status. If they're not feeling well, they may not be able to go get tested. There are also pros and cons of knowing test results. If you are infected, you may be able to isolate and protect your loved ones, but you may also not be allowed to work and lose income. We often think of testing as one entity, but it's usually several, 2 to 3 different steps. You need to have the testing sites, so there has to be availability and accessibility of testing sites. You need people and supplies. Specimen collection and management sometimes require transportation to the laboratories where these tests are processed. So you need the laboratory capacity, you need people and supplies. Once you get people screened and you get the test results, you need to be able to do something with that information. If each site has its own data management systems, it's going to be really difficult to put all of that together to inform policy. So we need coordination of information technology systems to form a robust surveillance system and a notification system so that the information can be used by the public, researchers, and policymakers. This is part of knowledge translation. We need transparency and accountability in this process, and there has to be political will. We've seen the detrimental effects of lack of political will in places such as the US and Brazil, where the presidents downplayed COVID for a long time. So we need to be able to have good communication between researchers, policymakers, and the public so that people know if they need to get tested or what is happening and what their risk might be. As part of our group, we have developed a website for sharing information that we're finding. We've developed a database of policy-relevant international factors, case study reports, and we have these sections developed to describe some of the findings that we are seeing in our data. So the takeaways, there are many barriers to testing and reporting for COVID, which is leading to an undercount, and it could lead to improper interpretation of policy decisions and loss of trust in governments. The barriers I have listed do not include contact tracing, case management, or how we define and count COVID-related deaths, which has also been a problem. But all of these play a role in the spread of COVID. So we need to understand the contextual factors and the links between testing, data, and action, which underlie these country responses in the pandemic, but that's also important for cross-jurisdictional comparison. This project is registered at these 2 sites, and we thank the National Science Foundation for some startup funding. This is the list of our collaborators. Thank you very much for your attention, and here's some contact information, including our Twitter handle and our website link. Thank you very much.